David, I was telling Dave and Heather the phenomenal work that you guys have done, and we've come a long way over the past decade, culminating in the latest grant application, the AMXT 1501 trial, and the DFMO stuff that you're doing. Are you able to just give David and Heather and potentially our supporters, David, just a rough overview, a layman's summary of this particular grant application, David?
Sure. How long have I got?
60 seconds. I did just a couple of minutes.
Couple of minutes. So look, this is a treatment and a trial that we are really very excited about. We think it's really probably the most effective treatment that a drug treatment that anyone's tested in any of the DIPG models in the lab. It's actually it's a combination of one old drug and one new drug, which we'd sort of been playing with, and we really, particularly the old drug called DFMO, there was some rationale to try it in our models, but I wasn't really sure if it would do much. And what we found is it did something, but the cells, the DIPG cells, actually they're really dependent on this pathway that this drug treats, called the polyamine pathway. And this is something that was previously unrecognized. This seems to be a really critical pathway to keep the tumour cells alive. And so switching off this pathway with the DFMO, did something to slow it down, but not a lot. And what we discovered is that the DIPG bypasses this treatment by basically pumping in these extra polyamines from outside the cell. And so using this new drug, the AMXT 1501, we could block that resistance mechanism. And so suddenly we found this combination of two drugs, DFMO and the AMXT 1501, was absolutely incredibly effective. As I said, I think really the most effective drug treatment that anyone has tried in any of these DIPG models. And so, sometimes you might see, it's very hard to get anything to work at all in these animal models, just like it is in patients, which is why it's actually a good model, because they're very hard to treat. So it reflects what the disease is actually like. And so normally, if anything works, we get very excited if it can just extend the survival by a few days or a few weeks. And what we were finding is that we were completely changing the outcome. We were, getting mice surviving till the end of the experiment, till the end of the time we were allowed to keep them alive. But it was really working incredibly effectively. And so this trial is basically built straight off of that. We've been working very closely with the drug company. They're really excited about these results. They're very keen to support us. This combination treatment is currently being tested in adults with different forms of cancer. But because of these results, which we've shown in DIPG, they really want to push this, as this trial forward as soon as we get those final results in the adult trials, then we're basically looking to go and start treating kids with DIPG. So, that's my slightly longer than 60 seconds summary.
No, that's always to the point. I appreciate it. And David, are you able to just explain to Dave and Heather, as parents who are kind of late into the realm, who have kind of been shanghaied in at short notice amidst this tsunami of emotion and medicine. Can you explain to them, David, just again briefly, where we've come in the last decade, what you've witnessed via the support of the Q Starts Now and our collaborative, what has been achieved here in Australia?
Yeah, it's been quite a journey. And I guess during my training, I actually didn't see a lot of kids with DIPG, when I was in my early stage of training. And that's because they came in, they got the diagnosis, they had their radiation therapy, and they went to receive palliative care. And in fact, there was no research being done anywhere in Australia. In fact, we didn't have any models, we didn't have any cells. These kids weren't getting biopsies, so they certainly weren't having any other form of surgery. So no one was studying it, and the only treatment we had was radiation therapy. And I think, it was Ren and some other parents as well who started saying, "Look, we've got to do something, guys. This is not." And it was hard. It was quite a battle to get things going. People actually, we struggled initially to get funding before the Cure Starts Now came along, because people said it would be impossible to actually grow tumour cells, donated after an autopsy. But in fact, we were able to, and then we started screening thousands of drugs and found a few that worked. But then once we got the animal models up, they actually didn't work in the animal models, because I told you how hard they are to treat. And so it's been a long process, but we've only really been able. We started being able to do this because the Cure Starts Now. Another parent saying, "Look, you've got to do something," and actually, it's not impossible. We just need to start somewhere, and and it's been incredible support that actually gave us those first dollars to actually get us off the ground, to allow us to grow the cells. We still don't have a cure, and we still don't know which one will work, but at least now we are generating options. And I talked about it's like being, at base camp of Everest. We have all our gear together, we have all our equipment, and we've started to make real progress, and we are starting our ascent. And we are very hopeful that we are really going to make a difference for this disease.
We've been really excited to be part of a group who are parents working with the medical profession as well. And I think that's pretty important, and that's why we're 100% committed. And we are very pleased to be involved with the DIPG collaboration. And so we have contributed, and I'm not a charity person, but we have contributed whole heart and soul to the Cure Starts Now. And we're pleased that there's a bit of a breakthrough. And I mean, it sounds like a huge breakthrough, David. So we're very appreciative of that. So we will continue to support the Cure Starts Now, because I think it's root-based or parent-based, and working with the medical profession, which I think is pretty powerful. Yeah, so we're really pleased, and we're pleased to be, as I said, on behalf of DIPH and the collaborative, to fund your research. I don't know whether I should be announcing this or not, but and I think that you were saying that you required $266,741, and we're part of that, and we're pleased that we can help move it forward. Well,
that's there's the big check. Wow, that is a very big check. That is absolutely amazing. Thank you so much. That is that's incredibly exciting.
That's the best rendition of Delvine Delaney that I can do.
That's beautiful, Ren. Beautiful. Thank you so much. It's amazing. Amazing.
Yeah. Well, we hope, and we hear the passion that you have in finding it, because we obviously were beside ourselves. Our son died only last year, on the 4th of April, dare I say, and it all happened so quickly, and there was nothing out there. So we really are in it to help other people, and other children, other parents, and I think working collaborative, the parents working collaborative with yourself, David, is fantastic.
Dave and Heather have thrown in a phenomenal, an earth-shattering amount of fiscal support behind this check, buddy. So their son DJ, consider this a huge part of the legacy of their son DJ, David, which I know